Feeling more forgetful lately? Struggling to focus or remember even simple things? It might not be old age, it could be your medications. In this video, we reveal 7 commonly used drugs that may silently be damaging your brain, reducing mental sharpness, and even increasing your risk of dementia. Let's dive in. Welcome back to Health I Seek, the channel where we bring seniors the truth about natural healing, vitality, and aging strong. Disclaimer: this video is for educational purposes only and does not substitute any medical care. Always seek advice from your doctor before making any changes or decisions regarding your health. Medication number 1: antihistamines and sleep aids that block memory chemicals. Millions of people take medications like Benadryl, Tylenol PM, and Advil PM to treat allergies or fall asleep faster. But the hidden danger lies in a key ingredient, diphenhydramine. These medications are part of a drug class called anticholinergics, which block acetylcholine, a neurotransmitter essential for memory, learning, and mental clarity. In fact, Alzheimer's drugs often work by increasing acetylcholine, while these drugs do the opposite. Over time, blocking this brain chemical may lead to cognitive impairment and even permanent memory loss. A landmark study published in JAMA Internal Medicine found that people who used anticholinergics regularly for more than 3 years had a 54% higher risk of dementia. Medication number 2: anti-anxiety drugs that shrink your brain over time. Benzodiazepines like Xanax, Ativan, Valium, and Klonopin are commonly prescribed for anxiety and insomnia. They work by slowing brain activity, but that calm comes with consequences. Long-term use leads to brain shrinkage, especially in the hippocampus, the area responsible for memory and learning. A French study that followed 8,000 elderly patients found that benzodiazepine use increased dementia risk by 50% to 84%, even after adjusting for anxiety itself. Brain imaging has shown reduced brain volume in long-term users, and cognitive decline can persist even after stopping the drug. Medication number 3: acid blockers that starve the brain of vital nutrients. Drugs like Nexium, Prilosec, and Prevacid, known as proton pump inhibitors, PPIs, are used for acid reflux, but they come with hidden cognitive costs. These drugs suppress stomach acid, which is critical for absorbing nutrients like vitamin B12, magnesium, and iron, all of which your brain needs. Deficiency in vitamin B12 can cause symptoms nearly identical to dementia: confusion, poor concentration, and memory loss. A German study of over 73,000 older adults found a 44% higher risk of dementia in those taking PPIs long-term. The risk doubled after 4+ years of use. Medication number 4: cholesterol-lowering statins that block brain fuel. Statins like Lipitor, Zocor, and Crestor help lower cholesterol, but they may also rob your brain of a key building block. The brain holds 25% of the body's cholesterol, which helps neurons communicate and form memories. Some statins cross the blood-brain barrier and suppress cholesterol inside the brain, disrupting nerve function and mental clarity. Statins that are lipophilic, fat-loving, like simvastatin and atorvastatin, are more likely to enter the brain and cause side effects like brain fog and memory lapses. Studies suggest up to 15% of statin users report noticeable cognitive issues. The FDA has even added cognitive side effects to statin warning labels. Medication number 5: first-generation allergy drugs that mimic dementia. Older antihistamines like chlortrimeton, Atarax, and again, Benadryl are still widely used, but they're neurotoxic to the brain in large or long-term doses. They penetrate the brain easily and block acetylcholine, causing attention loss, slowed thinking, and memory failure. A brain scan study from Indiana University showed that chronic users of these medications had brain shrinkage and reduced glucose metabolism, signs also seen in Alzheimer's disease. Medication number 6, seizure and nerve pain drugs that slow your brain down. Anti-seizure drugs like Dilantin, Neurontin, gabapentin, Tegretol, and Depakote aren't just used for epilepsy, they're now prescribed for nerve pain, bipolar disorder, and migraines. But here's the catch. These medications work by slowing down electrical activity in the brain, which also slows down thinking, attention, and memory. A study published in Epilepsy and Behavior found that even low doses cause cognitive slowing, attention lapses, and reduced mental flexibility. Medication number 7, blood pressure drugs that reduce brain oxygen. While managing blood pressure is essential, some drugs, especially beta blockers like Inderal, tenormin, and metoprolol, may interfere with brain function. They can reduce adrenaline-based alertness and sometimes lower blood flow to the brain, especially in older adults. Research shows beta blockers that cross into brain tissue are associated with slower thinking and memory decline, particularly if blood pressure drops too low. Just because a medication is common doesn't mean it's harmless. Many of these drugs, when used long-term or without monitoring, can quietly degrade your brain health. Medication number 8. Antidepressants with anticholinergic effects. Paroxetine, Paxil, amitriptyline, doxepin. These older antidepressants block acetylcholine just like Benadryl, can cause confusion, blurred thinking, and memory problems, especially in seniors. SSRIs, like sertraline or escitalopram, have fewer cognitive side effects. A Harvard review linked tricyclic antidepressants to higher dementia risk due to their anticholinergic burden. Medication number 9, opioid painkillers, oxycodone, hydrocodone, morphine, affect brain regions related to memory, emotion, and attention, reduce oxygen to the brain, and interfere with neuroplasticity, the brain's ability to adapt and form new memories. Chronic use leads to mental fog, low motivation, and long-term memory decline. Study. Research from JAMA Psychiatry showed long-term opioid users had poorer memory and executive functioning than non-users. Medication number 10. Antipsychotic medications, especially in seniors. Risperidone, haloperidol, olanzapine, often prescribed off-label for sleep or agitation in elderly patients. Reduce dopamine, impair frontal lobe activity, and cause sedation, confusion, and memory problems. In seniors, linked to faster cognitive decline and even increased mortality. The FDA has issued a black box warning about the use of antipsychotics in elderly dementia patients due to severe cognitive and physical side effects. Before making any changes, always speak with your doctor. There may be safer alternatives or ways to reduce dosage without compromising your health. If you found this video helpful, hit the like button, share it with someone who takes these medications, and don't forget to subscribe for weekly videos on how to protect your brain, heart, and overall wellness.